So my name is David Issom. I am an E patient. So E stands for expert and empowered. And besides that, I'm also a PhD student in health informatics at the Geneva University Hospital. And I got the honor, thank you, to be here, standing in front of you, to share with you my story, the story of my life. Everything started in 1997 in Geneva, Switzerland. Nice city, a nice small country. Try to remember, during this period, Michael Jackson was starting with the man in the mirror. And I was starting with my first symptoms. The sickle cell pain episode, or called also crisis for the experts. So it's a very, very complex type of pain. Like there's even a book of 800 pages that has been written to try to describe it. But I will try in 30 seconds. So, imagine northern Sweden, January, very dark, very cold, lot of snow, and you're driving your car, and there's a snow avalanche. So you get stuck in your car. You cannot go out, you cannot open the window, you cannot open the door. But, by chance, because you're in Sweden, you were at a Viking party, and you got a hammer next to you. So you take it, and you smash the window and the door. You try to open it, you panic, you want to go out. Very, very strong. So that's sickle cell pain in 30 seconds. So as you understood, got diagnosed with sickle cell disease after some months, which is one of the most common genetic diseases in the world. Very deadly. Most of people are dying before their 5th birthday. And I also had a very bad prognosis. And my doctors kept telling me that I should not live more than 5, 4, 3 seconds, sometimes days, sometimes hours, months, years, but very bad prognosis in general. But I didn't. Because of the help of my relatives, very excellent doctors and nurses that could provide me an excellent quality healthcare. Also Switzerland helps. And I could keep doing things I like to do, such as riding motorcycle. But the disease remained always like a sword of Damocles, always here. And sometimes, poof, it occurs without any warning, and stopping you from anything you will be doing. And you know, it's not a very fun feeling because you are always balancing between full life or imminent death, survival. It's not so pleasant. And when you have a crisis like that, the only thing you want is to make it stop. So sometimes you have to go to the hospital. So you go to the ER, you ask for help, you tell what you have, and then you always have to ask for huge doses of painkillers, morphine, etc. And then you wait for hours, sometimes for days. And why? I don't really know, but most probably because it's not visible disease. You don't have blood everywhere. So please, listen to the patient. If you don't know what to do, if you're not sure, ask him. Ask, for instance, is it a usual feeling, or what do you do in general when you get that? And then listen to the answer, and let the patient help. Also the caregivers, when the patient cannot answer, let them help. And after all this suboptimal care, I got really fed up and upset and angry. So I decided to stop. Now, help yourself. And that's what I did. I started to observe how everything will influenced my health. I was starting to listen a lot to my body, to my feelings, even my social interactions, to see how everything could maybe trigger a sickle cell crisis. And then I also started to learn a lot about the disease, about medicine. I even studied medicine for that. And I became an expert in myself first, but also an expert in sickle cell disease. And then I have insisted to get all the tools I will need to self-care. Like, for instance, I received oxygen bottles at home, or vital signs monitors like this one, and also reserves of morphine in case of need. And thus I became a new sickle cell patient. I could even start to predict about 2 weeks in advance when a crisis will occur, and my hospitalization rate dropped about 80%. And since I'm kind of a geek, I started to try on myself. For instance, I injected chips and sensors. I tried to program stuff. And then I moved first to Sweden and then to Norway. And there I could conduct research where we asked other patients worldwide what were their biggest concerns. And we found out that they all have the same concerns. In sub-Saharan Africa, in Switzerland, in the US, all the same. For instance, fear of an unpredictable crisis, which is something that will picture as lightning in a blue sky. Like, you don't expect it come. And also, fear of lethal complication. Like, yeah, most of patients they have had many kind of complications, everything you can imagine, and they're very scared of dying from it. And then they're also fed up of poorly trained caregivers, and fed up of being always isolated, stigmatized, and left alone. So we sat together with patients, and we designed tools that could help them to self-care during their daily tasks, such as, for instance, get support from other patients or from doctors. I could also help them to learn how to live well with the disease, or get some continuous monitoring with sensors. But this system is not yet finished, and we try to build it and test it very soon. So, my final thought. I think this disease is kind of a gift, because it reminds you that to live, you need to be very proactive. You need to take action. And to take action, you need to know yourself better. And small message for you, if you want to meet patients' expectation, please cultivate empathy, grow your empathy, and then listen to the patient, and let them help and decide with you. And then I hope we can make a change. And I suppose, and I believe, I'm probably biased, but the future is going toward that direction. Like, for instance, we see in Switzerland a lot of initiatives, such as this personalized health initiative, or in the US also with the individualized health initiative, that try to bring together patients, doctors, scientists, to collect and analyze and interpret huge databases of health information to provide patients, but also healthcare professionals, like tools and that can be very customized, like extremely individualized recommendations or advices or care plans for an individual. Thank you. And if you have any question, you can see me around there. Or I don't know if you have enough time now for questions. Thank you.
We do have time for 1 or 2 questions. Hello, my name is Åsa, and I work here in Sweden, and I've also seen some small children with sickle cell anemia. But I'm curious, with this, you said in 2 weeks ahead of time you would notice that it will come.
Yes.
So I'm curious about what is it that you notice, what is it you're sensing?
Like you feel that, yeah, your body is going wrong, something.
Yeah.
Sometimes it could be small pains that you will feel.
Mm-hmm.
Sometimes, it's difficult to explain that. It's feeling, because you know how it comes, you know how it goes out, and you can process all this information. You can be a lot more aware of your own body.
Mm.
And then you see that if I keep like that, I'm sure I will have a crisis in like maybe sometimes 1 hour, and it happens.
Okay.
And yeah.
But have you also found like a way to prevent it? Like, could you be more like rest more or drink more water?
Yeah, that's
or do
what
something
I do.
Yeah.
I do everything I can to avoid. But it's really a behavior change. You need to change your actions. For instance, you can be rest, it could be drink, it could be take more oxygen, or sometimes also the environment where you sit in. It could be in a place where there's a lot of smoke, for instance, and you will change.
Okay, yeah.
It's mostly linked to healthy behaviors.
Yeah. Okay, thank you.
Welcome.
Thank you. Thank you very much, David.
Thank you.